Today's day Nope. Today's day 29 post-op. I'm honestly starting to lose track of the days here. And honestly, I think we're kind of out of the woods with the actual part of the recovery, so to speak. There's no more pain in the flank that I took my tube out. All the inflammation's gone, so that's fantastic news. And tomorrow we get to actually look at the incision. I'm so excited to take this tape off. I have no idea what it looks like under there. There's like these tiny little spots in between like the tape sections here. And just by looking at them, the scars, it almost looks invisible already. I swear, Dr. Law is actually a magician, even though he claims not to be. So today we get to talk about something that's actually pretty cool because one of my friends, who is also another fat loss content creator, Johnny Goes Running, is losing a bunch of weight and is already starting to think about what he's gonna have to do for loose skin surgery. So we're on a call with him and he's gonna ask probably the question that most of you would ask if you were in a similar position leading into surgery. Okay, so what was your heaviest weight?
Heaviest weight, 497 pounds.
And now you're down to?
323.
A lot, okay.
Yeah.
So you're down
to
you're
170, yeah, 174 to be
crazy. Yeah. Okay, and you're thinking about it's almost snippy time.
It's getting there. It's not as far as I thought it was. So like I could really push. I could push pretty hard and get there probably at this time next year. My catch-22 is like I want to do these big, long, multi-day races. And I think loose skin might eventually like get in the way of like the 2-3 day races in a row. Right now it's just zero issues. Like I don't get any rashes. I don't get anything like that. So I can't imagine I'm losing more than another, 70 pounds before I get it.
Okay, well, look, so do you have a surgeon so far?
No.
Okay, awesome. Then, okay, honestly, what we'll do is you just ask me whatever questions that's been on your mind. I'll answer them, and then I'll give you like 2-3 pieces of advice that I've thought about in the last few days over the last few pieces of content that's been floating around the internet there.
So it's just a catch of like how lean do I get, but also I don't want to wait 5 years to do it. So at what point should I do my consultation? Like, is it any benefit to doing it right now when I'm still probably 60, 70 pounds away? I got a lot more muscle mass than a lot of people that get loose skin surgery. Like, I mean, I'm similar to like you, but you're obviously way more jacked. But
I don't think people know how jacked you are just yet. And when you get that out, it's gonna go crazy.
Yeah. So like for me, a 250 would be lean, like pretty lean. Like I don't think without losing a ton of my muscle mass, it's gonna be hard to get down any lower than that.
When I asked that same question to Dr. Law about people asking me that, his answer was very good. It was, you want to get down to the weight where you're going to be living at for the next foreseeable future. And the reason why behind that is because, well, post-surgery, you don't want to drop more for a while because just because of the simple fact that your skin's going to be healing and you don't want to be in a crazy deficit. You want to maintain for a while. But also, if you get it done, let's say too early, then you're going to be faced with the problem of having more loose skin afterwards, which is obviously not beneficial because you just got it removed. Obviously, it wouldn't be as much, but still. And also, the more tissue is removed from your body, the more traumatic it is for your body to heal from it. So the more actual fat cells are removed, the more that it's going to disrupt your natural body's ability to store fat. And that's when you have people that get like these like weird fat paddings around parts of their body that they didn't have it before, just because that your body still has to store fat, but it doesn't have it anymore where it used to. Right? Okay. So that equilibrium is gone once that skin is cut off. So in terms of the paper thin, some people will have much of a harder trouble to get down to that because of the amount of subcutaneous fat that just is stored depending on where it is. But still, like anybody could get there. For you, how tall are you again? You're like what, 5'11"?
Yeah, 5'11", 6 feet, yeah.
Yeah. I honestly think that your surgery is probably going to be around the same weight as mine, which was like the 240s. Another thing, too, also that you want to watch out for is, I'm going to tell you, start your consults now. Just because it might take you a while to find the right doctor for you. There's a lot of good doctors, and, we've seen that there's a lot of doctors that are questionable in their practice and the medical staff and stuff.
So what's, like, my biggest thing is, like, what's the recovery time on it? Like, what is that? When can I get to like back to doing the tough stuff? Not like just light movement. Get back to going from like, okay, day 1 you get surgery, day X what's like now I'm running and gunning and working, doing whatever I want?
There is no perfect answer to that question, just because everybody's bodies will react differently to recovery. But there's definitely some things that can like come into play. So definitely make sure to ask your surgeon beforehand, like what his pain management protocol is like, because the rougher the start of the recovery, the rougher the rest of the recovery, and the lengthier that time will be. Because again, your body's reacting to trauma, you're storing inflammation, and that makes everything heal slower. Versus if you come in there and they have like a preemptive pain management protocol, a intra-surgery pain management protocol, and a post-surgery protocol, then chances are that you'll be a lot faster. So like technically speaking, well, I'm about to start my cardio today. I technically should have been able to start doing that like a week and a half ago, but I have Crohn's disease, so everything's out the window.
Gotcha.
But for standard patients, for let's say Dr. Law, his is 2 weeks like more sedentary living, 2 weeks introduction to cardio, and by week 6 you're back like 90%, 95%.
Really?
Yes,
really?
It's insane because
like, but does that have anything? But does that have anything to do with the fact that like obviously I'm going to get way more removed off me just by being a bigger guy at the start than you do? Like the more skin I take off, the more trauma. I would assume the longer recovery.
Yes and really. No. Right. I mean, of course, there's nuances and there's differences, and some people react to it better than others. But I mean, the fact that you have all this muscle on your frame is definitely an advantage, because people with more musculature will generally recover better than those who don't.
Got you. Okay, that makes sense.
Yeah,
makes me feel a little bit better. I'm like, if I'm going to be down for 6 months, I can go like, till I can go like really back at it, like to where I'm running, half marathons, all that kind of stuff. Obviously, I'm sure on your end, your fitness has taken a pretty big tank as you haven't been able to do things. Your strength has gone down, all that kind of stuff. So I'm trying to time it before I go for the crazy outlandish stuff, but not to where it stops me from doing the stuff that I want to do. You know what I'm saying?
See, what you said there is definitely like that's the old fat Johnny talking right now. That you want everything right now.
Yeah, for sure, 100%.
Like, you know what I mean?
So I'm trying to time it, because if I have these goals of doing this in 2-3 years, running an outlandish goal of running across the province or the country or something like that, then if I get to the point where I'm waiting 2-3 years to get surgery, then that build up to get there is I have to delay that.
Like, if anything, what I would tell you, like, okay, in the content creator eyes of it versus like the normal human beings like vision of it,
yeah.
A content creator side of it, taking the time to do it is fantastic, because you get more content out of it, and obviously it's very performing content. So
for sure, for sure.
As the normal human being side of things, I think that's something that I only realized yesterday, and that's why I made that post yesterday the way that it was like just those 3 pictures, which is like I took 1 year to lose the weight. And then I took 1 year to fix my body. And then I'm going to spend 1 year to get jacked to shit. Realistically, because you're not like, your goal isn't to, hit a 600-pound bench, or it's not to get like bodybuilder ready.
I mean, it's not out the window.
Exactly. Like, I think that your recovery is going to be a lot faster because you're going back to running, and like you'll be able to essentially retrain yourself by like during your recovery, instead of running, maybe going on the elliptical for like about a month and really going heavy on that, and then introducing running slowly on the treadmill, and then going back to street running, because obviously that's more impact.
Yeah, I mean, it makes sense. Yeah.
Like, let's just keep talking about it over like the next few months. But if I was you, I would start like looking into doctors right now.
You don't have to like stay in nurses and change all your stuff. Isn't that a thing?
No, I left 5 days later. So for my gyno, I left 3 days after. For my tummy tuck, I left 5 days after.
So is just because didn't Jesse have to sit in a hotel for like 2 weeks and have a nurse come? And isn't that a thing? I thought that was.
Like for you guys, depending on the amount of loose skin removed all at once, that might be a thing. Because of course, like, I mean, his was a lot more traumatic than mine too, right? Like
for sure,
22 pounds versus 2 pounds. Like it was like 1.5 pounds for me is a very different story.
Yeah. Okay, all right, that makes sense. Because I'm going to be more on their side, because I'm sure I'll have to cut a bunch of stuff. I'm sure I'll have to do it in multiple surgery. There's no way I'm doing everything at once.
Which my legs is smart.
My legs actually have more loose skin than anywhere else in my body.
No shit.
Yeah, my legs have a ton of loose skin.
Well, like, trust me when I say though that like, if you find a doctor that tells you that he's worried about doing it all at once, he's a good doctor.
Yeah,
because that means he actually values your safety. Like,
yeah.
So obviously loose skin is an issue that concerns a lot of people before they even start to losing weight. And that's something that we'll probably have to make a separate video on because it really shouldn't be. But if you are at the point where you are starting to accumulate loose skin, at least know that there are some options and you don't have to be stuck with it for the rest of your life. Yes, of course, there are some things associated with cost and recovery and other subjects that we'll probably end up covering in later videos. But I think that the first thing that I would like to address is, what are your concerns? Do you have loose skin currently? Is it something that's bothering you? Is it something that you just can't deal with anymore and that you're looking into surgery? Or is it something that you've maybe found ways to mitigate how much it was annoying you? Is it by wearing some type of compression garments? Is there anything specific that you have been able to do or deal with it in general? I know that I was using obviously that GHKCU while I was losing weight to mitigate the accumulation of loose skin, which is definitely playing a part in why I had so little, but there's obviously other genetic factors at play. So technically I'm filming this today, the day I'm releasing this video. Usually I'll record the day before and then post it in the morning of. This video is going out at 9, hopefully. It's 8:25, so I should probably wrap this up. And that means I'm actually gonna be removing my tape and just very soon here with Dr. Law on a call. So let me know in the comments, is there anything specific that you would like to know about loose skin, about surgery, about recovery? And I'd love to make a Q&A video in the next coming days. So yeah, drop everything you have. Thank you for watching as always, and let's change the world together.